Established in 1959, Rossdales has evolved over the last 60 years into a world leader in equine veterinary medicine. Today it's the largest equine referral practice in Europe, with more than 50 veterinary surgeons and over 100 support staff. The foundations for the practice were laid 60 years ago. Peter Rossdale's vision was for a practice based on scientific principles and evidence-based medicine.
Well, I came from a medical family. My father was a general practitioner and both my brothers were in the medical profession. So I think my attitude was very different in a way to the veterinary attitudes of that time. And I became very conscious of the lack of evidence. The clinicians at that time were excellent clinicians, but they all existed to a degree on opinion. And I questioned their opinion on scientific grounds. I didn't think by no means did I think I knew better than them, but I thought we all knew too little. In 1957, I embarked on a thesis for the fellowship of the Royal College on the health status of the newborn foal, and so that I became encouraged to try and find out the basis of facts of diagnosis and therapy, and that in a way filled my life.
Being able to offer clients an individual, personalised service was important to Peter when establishing his client base, and are qualities which are still integral to the ethos of the practice today.
I think a personal service is one which particularly horse owners do appreciate. I don't say that small animal clients don't, but I think the owners of horses, trainers and stud managers and stud owners, they want the individual and the individual to be available.
Peter set up his own practice in 1959 just outside Newmarket, with the support of local trainers, studs and owner breeders. After 2 years, Peter was joined by other pioneering veterinary surgeons when the practice moved to Beaufort Cottage Stables in the centre of Newmarket. Today this remains the base for the practice's ambulatory team of vets, dispensary, accounts department and laboratories. For more than 50 years, Rossdales Laboratories has been a market leader in diagnostic referral services.
The basis was to provide a clinical pathology service that was always available, tailored specifically for the needs of an equine practice, and in particular for Rossdale and Partners. The service grew and grew and grew, and because it grew, we were then able to take on more technicians, we were able to afford more technology, we were able to expand the tests that we did, and all this fulfilled Peter's ethos and Peter's vision of a growing laboratory which would be very, very helpful to Rossdale and Partners, which it was. Then this eventually led to the fact, well, this case is not really improving. Could you see it? Or could one of your colleagues see it? And so therefore this was the start, really. It enabled not only the clinical pathology service to grow, but it also was the start, really, of Rossdale's referral service. And you have to remember in these days, it was not normal for veterinary surgeons in practice to refer to other veterinary surgeons in practice. This was considered a bit of a defeat, and so it took time and the fact that the service we were offering was not available elsewhere for this to catch on. But it did catch on, and so therefore cases came in for us to have a look at, and whoever was the most appropriate person in the practice saw that. And that was the start, really, of the referral services.
As Rossdale's referral service increased in popularity, the practice recruited more expert veterinary surgeons and support staff to meet the demands of this service. This resulted in a need for more space, new technology and additional facilities, which led to the development of the Exning site, just 2 miles from Newmarket. A diagnostic facility was established in 1991 at Cotton End Stables in Exning. And during the next few years, with the support of the Exning estates, the site underwent a huge transformation. This resulted in Rossdale's state-of-the-art hospital being built, which was officially opened by Her Majesty the Queen in 1998. The hospital development provided 2 operating theatres, 3 padded knockdown and recovery boxes, and a dedicated stable yard with over 30 boxes. This allowed Rossdale surgeons to carry out an ever-increasing surgical caseload and to pioneer new surgical techniques and utilise new technology.
As a practice, we've tended to embrace technology where it's valuable. And in the modern day, certainly keyhole surgery is a very good example of that. Keyhole surgery has revolutionised quite a lot of the things we do. For example, in orthopaedic surgery, the ability to make minimally invasive incisions, look inside a joint, diagnose and treat and deal with the problem has revolutionised outcomes and also diagnosis.
In 2008, Her Majesty the Queen returned to the X-Link site to open a new diagnostic centre for Rossdales. This significant addition to the hospital facilities included dedicated MRI and CT suites, a number of clinical examination rooms, and a dedicated standing surgery suite.
At Rossdales, minimally invasive surgery and standing surgery has been something that we've embraced. And many of the things that we did 25, 30 years ago in the patient under a general anaesthetic are now done under standing sedation and local anaesthetic. Examples of that might include sinus surgery and dental surgery, laparoscopic surgery, but also fracture repair. Fracture repair is something which carries a risk. If in certain selected cases we can repair that fracture standing under local anaesthetic, then the horse avoids the need for a general anaesthetic.
A number of our specialist clinicians also have expertise in the treatment and management of sports and exercise-related injuries.
Many of the lamenesses will require medical management, and we have the latest biological regenerative therapies such as stem cells, IRAP and PRP, to name but a few, as well as high-power laser treatment to treat soft tissue injuries and shockwave therapy.
In 2017, Rossdale's specialist facilities were further enhanced with the addition of a purpose-built state-of-the-art medical intensive care unit. This allows their internal medicine team to provide the highest levels of biosecurity and medical care for the sickest or potentially contagious patients.
Horses come to Rossdales for medical investigations for quite a wide number of reasons. I'm here in our brand new medical intensive care unit, which is a really great facility that we have. This unit particularly is for our care of neurologic patients, where we have a hoist and a sling, which means we're able to offer the best level of care for horses that have conditions such as herpes virus infection or that have sustained an injury to either their head or neck. And in here we're able to hoist horses up and down and obviously give them fluid therapy and intensive care. So this is one area that we're able to provide medical care and nursing for patients. Also within this facility we isolate horses that have other diseases, so that might be horses that have diarrhoea.
Our Newmarket-based racehorse and stud teams have for many years operated one of the largest thoroughbred ambulatory practices in Europe, additionally providing services at all bloodstock sales locally and abroad.
We look after our thoroughbred clients here in Newmarket. This involves looking after the stallions, the mares, as they get in foal, monitoring them through their pregnancies, and then looking after the young stock, the foals and yearlings, until they either go to the thoroughbred sales or into training.
Additionally, the practice has a dedicated ambulatory team, providing veterinary services to an ever-increasing number of sports and leisure horse clients. Rossdales expanded its ambulatory services by opening 2 branch practices, the first in Hertfordshire in 2012, predominantly catering for leisure horse clients. The second was opened in Lambourne in 2017 and provides a dedicated racehorse and stud team. Clients of both these practices can benefit from the specialist expertise and facilities available across Rossdales. An important element in the success of the practice has been the many talented people it employs. Our vets, nurses, technicians and support staff each play a vital role in providing an outstanding service to our clients. Today, Rossdales employs more specialists than any other equine practice in the UK. These specialisms include equine surgery, internal medicine, reproduction, diagnostic imaging, dentistry, sports medicine and rehabilitation.
I graduated in 1976, and at that time the Royal College of Veterinary Surgeons did not acknowledge specialisms. However, in the early 1990s, the Royal College allowed individuals to label themselves as specialists in certain areas and certain disciplines of practice. I became an equine surgeon. The Royal College ran examinations in equine surgery, and subsequently the European College of Veterinary Surgeons developed, and I became one of the first diplomates of the European College of Veterinary Surgeons.
Upholding Peter Rossdale's original vision, scientific research and the education of other veterinary professionals is integral to the Rossdales culture. Many Rossdales vets have been published widely in peer-reviewed journals and lecture at Rossdale's own CPD events, as well as at conferences throughout the UK and worldwide. In 2018, the practice's hospital, Newmarket practice and laboratories were awarded outstanding in 5 categories under the RCVS Practice Standards Scheme. As Rossdale celebrates its diamond anniversary, Peter Rossdale reflects on how it will be the current and future generations of vets and staff who will ensure the success of the practice in the next 60 years.
Because I think that one has to leave it to the people who are actually doing the work and involved to formulate their own policy and ideas in relation to the ambient conditions of that time. I mean, I think for someone who started in 1959 to advise how people in 60 years later should act and behave is a bit impertinent.
The veterinary profession is currently going through a period of significant change, and Rossdales is proud to remain an independent practice. Our continual investment in our people, our infrastructure and cutting-edge technology, together with our passion for being at the forefront of the latest research, will ensure we continue to provide all of our clients and their horses or ponies world-class veterinary care. We now look forward to the next 60 years.